Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Do Medicaid patients have to be homebound to get benefits? This is a huge point of confusion for so many people, and today we're going to clear it up once and for all. The short and simple answer is no, but the reason for the confusion is understandable because the rules often get mixed up with another major program, Medicare. Let's break down the key difference. For general Medicaid coverage, you absolutely do not need to be homebound. Medicaid is a health insurance program for low-income individuals and families. It covers essential services like doctor visits, hospital care, and prescription drugs. You can be perfectly mobile, go to work, and live an active life while on Medicaid. The primary eligibility for standard Medicaid is based on your income and household size, not on your ability to leave your home. So where does this homebound idea even come from? It comes from Medicare. Medicare has a very specific rule for its home health care benefit. If you need skilled nursing care or therapy services provided in your home, Medicare will typically only cover it if a doctor certifies that you are homebound. For Medicare, being homebound means that leaving your home is a major and difficult effort, and you usually need help from another person or a device like a walker or wheelchair to do so. This rule applies specifically to Medicare's home health services, not to all of Medicare, and most importantly, it does not apply to Medicaid in the same way. Now, Medicaid does have its own programs for in-home care, and this is where things can get a little nuanced. These are often called home and community-based services, or HCBS waivers. The goal of these programs is actually the exact opposite of keeping you homebound. They are designed to help people who have a high level of need, what's often called a nursing home level of care, to stay living in their own homes and communities instead of having to move into an institution. So, to qualify for these specific in-home support services through Medicaid, you do need to demonstrate a significant need for assistance with daily activities. But the purpose is to support your independence and community involvement, not to restrict you to your house. These services can include personal care aides, help with chores, and even transportation to appointments or community events. So let's recap the main points. First, for regular Medicaid health insurance, you do not have to be homebound. Eligibility is based on your income. Second, the strict homebound rule is primarily a Medicare requirement for certain home health services. And third, to get special in-home care through a Medicaid waiver program, you need to show a high level of medical or functional need, but the goal is to keep you out of an institution and active in your community. I hope this clears up the confusion between being homebound and receiving Medicaid because it's a critical distinction that affects how you access the care you need. Thanks so much for watching. If you found this video helpful, please give it a thumbs up, it really helps the channel grow. And if you have more questions, drop them in the comments section below. For more straightforward explanations of healthcare topics like this one, make sure to hit that subscribe button and turn on notifications so you don't miss our next video.